I'm John English, consultant dermatologist since 1989. Been working at Circle since 2008, previously in Nottingham since 1996. I've always been interested in technology and dermatology and photography and images because obviously dermatology is a very image-strong subject, i.e. you look at it and you can make a diagnosis. One of the great things about teledermatology, it increases our capacity because it means I can see probably 10 patients in an hour on telederm, whereas I can probably only see half that number or less in the clinic. So it increases our capacity. That means we can speed up the waiting time. At the moment, it's probably 2 or 3 months at least to see us. In the telederm, it would be 2 or 3 weeks. And another advantage is for the GPs get the feedback much more quickly. The GP refers a rash in normally, it takes 3 months for them to get the feedback and the results of that. They've forgotten about it, but if they get it within a week or a few days, then they'll learn much more readily. We've done surveys of our patients and they're all very pleased, but they are offered the choice of waiting 3 months or being seen within a week or two. So most patients will choose to be seen as quickly as possible. It does save money. We have saved the health authority over 200,000 in our first year that we did it. The great thing about an organisation such as Circle is that it can innovate. In fact, it has to innovate really to survive, and that's probably true of all healthcare organisations, but fortunately Circle is really keen to develop ideas and has pushed this telederm in Nottingham. And when we launched it, we had the room down at the end of the corridor absolutely full of GPs. I've never seen so many GPs in one room. They were very keen to get involved with this.
So my name's Gareth Mannering. I've come here today for a small mark that's on my leg. I first noticed it probably around 5 years ago, but it's not really caused me any issues until about 3 or 4 months ago when it started itching a little bit. My understanding is it would have taken possibly 6 to 8 weeks to get that appointment. And as such, I saw my GP about this 4 days ago. I got a call about it Friday just gone. So actually 6 days later, I'm able to see someone for this service to get pictures done. So 6 days versus 6 weeks. The booking procedure and everything, dealing with anyone at Circle has always been first class. I've come here for other things as well. I'm related to this condition, and the treatment and the service of the staff has always been brilliant. So I'm more than happy to come here. As soon as they say treatment centre, I'm more than happy to come here.
So my name's Waka Wasti. My skin condition is a keloid scarring on my back and chest, which started around, I want to say when I was about 15, 16, progressively getting a bit worse over the years. Now I'm at the age of 20, I've decided to get some help about it. The process of getting the appointment that I've just had today was relatively easy and straightforward and really quick. I can now look forward to seeing some results from in the next week or two about what can happen. If not, then I have a definitive answer about where I stand with my skin condition. The environment in Circle here today was absolutely brilliant. I had no trouble finding the centre. When I needed to find which gateway I wanted to go to, someone actually came up to me and asked me if I was lost, so that was very helpful. The reception, extremely helpful in terms of telling me how long I expect to wait and when I'll get seen. So it was really good.